I'm back. I'm so sorry I had to run out. Bathroom, you know how that happens. Woman issues.
All right, well, welcome back.
Thank you.
All right, so we were talking about things that you can do at home minus the medicine to help you out with your GERD symptoms.
Right, and I think before I had to run out, it was like I said, no pizza. I know that tomato soup is also a trigger, so once in a while I will indulge, but I try not to.
Yeah.
Especially at night. Like, I try not to have it right before bed.
That's a great idea, and that's one of the things that I wanted to mention is not trying to not eat right before bedtime. And if you feel when you're going to bed, if you feel like you're burpy or you've got some symptoms going on, heartburn, you can elevate the head of your bed. You can have some pillows behind you and just sit up a little bit more.
Definitely have found that. And like slumping in my chair is a bad thing when I have the burps. Yep.
Right. Okay, so those were a few things, and then I know we had kind of mentioned, you mentioned weight in passing, but that's a good thing to keep and maintain a healthy weight as much as you can, because that is a risk factor.
Thank you for the caveat. I'm 52.
I know it's different. And then the other thing, and I know you're a Mountain Dew fan, but we're going to try to avoid what?
Caffeine.
Caffeine and carbonated beverages.
Oh, that's right, the carbonation
great
too.
for your GERD.
But the Diet Dew makes me happy, and that's also a thing.
So you're going to have to find that balance.
Yeah.
Yep. Okay.
I have found if I'm having too much problems, I do cut down on it, and it does help. So I'm aware of the triggering nature.
Good.
Yeah.
Good. Okay. Can you tell me, let's just back up, 3 actions that you can take at home to help reduce your symptoms?
Avoid the food triggers. So notice I didn't say the caffeine part, but that's one too. But avoid the food triggers. I know fresh garlic is a thing that sets me off. So even though those mozzarella bites from Domino's are awesome, or Parmesan bites, I have to be real careful because they're soaked in garlic sauce. The tomatoes, yeah. Making sure to stay on my meds, make sure I don't miss a dose because I can tell.
Right.
Exercise is always good because it speeds digestion, and simple carbs, I guess complex carbs, but getting the carbs in there to help me not generate so much acid. So that's something
that your medication is doing as well, because it's
right.
a protein pump inhibitor,
yeah,
or a PPI, so that it helps to reduce the production of that stomach acid.
Right.
Okay, good. Just one more thing before we go. I wanted to make sure that you knew some things that if they come up, you're going to want to get in touch with your regular healthcare provider.
Okay.
So I know that you have asthma. I saw that, and so if you have, I'm so sorry. If you have an increased asthmatic attack,
right,
more of those more severe, then you'd want to get in touch with your doctor.
Right.
Also, if you have severe stomach pain, if you're having trouble swallowing or pain when you swallow, and then obviously if you're coming up with blood in your vomit or blood in your stools.
Blood is always an indicator to see a doctor?
Yeah. Unusual blood. You should definitely get in to see your doctor.
I don't have any more.
So thank you for coming in today. I'd like to follow up in, let's say, 6 months.
Okay,
if you could come back in. And I'm going to give you this pamphlet. It just goes over some of the things that we've already discussed.
Okay? Great.
There you go.
Thanks much.
You're welcome. Any further questions?
No, I'm good.
All right.
I'll be better.
All right. You take care. Have a good day.
You too. Bye-bye.
Okay. Bye.